My name is Mary-Louise McKay. I'm the manager at Cameronsbury Visitors Centre. As well as looking after the centre and the museum, major part of my job is showing people around the brewery, which involves a lot of walking up and down stairs, slippery floors, holes and grids and grates all over. So it can be difficult. About 15 years ago, I noticed a problem with my knees, and a relative said that it could possibly be my hip. It was something I had ignored for quite a while. I just thought it just aches and pains. And a few years ago, it started getting very, very painful. A visit to the doctor and then onto a physio revealed that there was quite a lot of damage to the hip, and I was referred then to the surgeon, Mr. Logachetti, who revealed that it was quite severe and that my only option really was surgery. My hopes really is to get back to work as soon as possible. This is a job that I absolutely love, and the frightening thing is not being able to do it anymore. So if surgery is the way to help me carry on in this job, then yeah, can't wait.
Hello, Marie.
Hello.
I'm Deborah. I'm one of the joint replacement nurses. All right. If you'd just like to have a seat, we're just going to take you in and take some information. My name's Deborah Amerigo. I'm one of the joint replacement nurses. When the patients attend validation, they already have had the pre-assessment, so we already know if they have any health problems, what medication they take, and that they're fit for surgery. At the validation, we just go over those areas. If anything's changed, we are made aware of those changes. We also give a lot of advice about what to expect after surgery, and they are medically clerked by a doctor. The patient also has an opportunity to ask any questions that they might have. Marie, would you like to come in now? One of the main questions is about pain relief after surgery, about their anaesthetic. A lot of people think they have to be awake through the operation, having a spinal anaesthetic, so we can explain there are other options. Also, a lot of people who live alone wonder how they'll manage at home once they get home after their operation, and we can explain that there are lots of other agencies around who can get involved and offer support. As well as ourselves, the joint replacement nurses, we visit patients at home after their surgery several times just to give them some advice and support.
So we do become a good friend, really?
We do, yeah. We see the patients in clinic as well afterwards, and often in physio, so we do get to know them well.
My name is Raj Logishetty. I'm an orthopedic consultant at North Eastern Hartlepool NHS Trust. Spinal anesthesia has many advantages over general anesthesia. Although patients think that they wouldn't hear anything or see anything if they have a general anesthetic, you can have the same advantages with the spinal anesthetic as well. The spinal anesthesia, the advantage is there is less blood loss during the operation. That's one advantage. For the patient, the advantage is if they want to sleep during the procedure, they can request the anesthetist to give them sedation and they won't hear or see anything. But they will be having an operation under spinal anesthesia. The main advantage for the patient is after the operation. If you have a general anesthetic, there is more sickness and the pain hits you as soon as you wake up. With the spinal anesthesia, because the nerves are numbed, their effects last about 6 hours on an average, so you get good pain relief after the operation for a good 6 hours without the sickness. Our normal ball at the top of the thigh bone is smooth and it is covered by white hyaline cartilage, which is a glistening surface. It's a slippery surface as well. But as we go along in life, this slippery, smooth, glistening surface thins out, and sometimes in places it totally exposes the bone. So when the bone is exposed underneath the hyaline surface, the nerve endings are exposed and the movement is not smooth. It grates and it causes pain every time you move your thigh bone. So what we do is we scrape away all the rough surfaces, put in plastic on one side, which has been in the market for 50 years, which it is a very strong lining, and the other side we put a ceramic ball which is hard, and together they make a good bearing surface, giving a long lifespan for the hip.
Morning, y'all. Anywhere special?
I could hear noises. I could feel movement, but no feeling. There's no pain. It was just there.
And you fell asleep. Did you notice that?
I fell asleep. Yeah, I was ready to go to sleep. My earphones were in, so I had my music playing. And then suddenly became aware, and it was all over. It's like a cup of tea.
Oh, that's good.
As soon as you get back to the ward.
I've seen a lot of patients in my 16 years in the trust. I've done thousands of them, and their hip replacement procedure changes their lives. They can go back and do what they want to do. They can walk, they can play doubles tennis, and they really start to enjoy their life. If somebody is suffering to walk short distances, and if they have hip osteoarthritis, I would recommend this procedure fully.
My name's Claire Brazy, I'm a staff nurse at the joint replacement unit. Enhanced recovery is basically where they're pumping the anaesthetic directly into the wound instead of, we normally would have just where they have the epidural and a PCA, where they would press the button themselves, but the enhanced recovery, they get an anaesthetic directly into the wound, which tends to help better with the wound management. They have a lighter spinal, which means they get up on the same day, as opposed to getting up the day after surgery. I think it's a lot better for the patients because they're spending less time in the bed. They're up the walking, and it's a quicker recovery rate. Sometimes they can be home as quick as 2 days with enhanced recovery.
Marie McKay, please.
Hello.
The support is just unbelievable. They are also friendly. They are so helpful. They ask if you have any questions. Normally you don't, because they've covered everything. My one piece of advice is to write everything down. Write things down so that you do have something to tell them or something to ask them. But you will find that they've got it covered.
This is an X-ray of your new hip. This is a before and after. This is the damaged part of the bone which they've taken away. So you can see here where the bone finished.
I find now that I wake up in the night still, and probably because of habit, but there's no pain. So it's a case of like, you wake up and think, oh, okay, just turn over and go back to sleep.